quick. Let's say this is a schematic of the heart, but this is what we'll be focusing on: the right atrium, left atrium. We'll be looking at how the inter-atrial septum is formed. Now, let's assume that the right atrium is here and the left atrium is around here. Ignore the right ends first. In between, you're going to have one septum which is going to form downwards this way. Okay, the septum is going to form downwards this way, and right at the center there's what we call an endocardial cushion, which helps with formation of the valves and the septum. Okay, now this first septum that comes down is called the septum primum, just language really, and as it goes down, it makes this place in between an ostia, and that is the first ostia, the ostium primum, which still allows a right to left flow of blood. Now, as this septum primum goes down, just before it joins, the superior aspect of the septum primum is going to disintegrate to allow continuous right to left flow of blood. This ostia that disintegrates is called the ostium secundum. Pardon, the ostia is 2, ostium is 1. So this is the ostium secundum, which allows continuous right to left flow of blood whilst this fuses. And let's designate this as the remnant. Now, just by the side of this remnant here, there's going to be the appearance of a second septum which forms down, which goes down, called the septum secundum. This remnant here is eventually going to disintegrate. Now, just by the side of this septum secundum, remember from our previous lectures where the sinus venosus joined with the right atrium is going to form 2 valves, and at the top of the valve we're going to have the septum spurium. This septum spurium at the left part of this valve is going to join with the septum secundum to form a very thick septum secundum that is eventually going to go and grow down such that it's going to overlap against this inferior aspect of the septum primum. Now, remember, there must always be a right to left flow of blood, and in the fetal heart, the pressure in the right part is higher than the pressure in the left part. Because of this pressure difference, this blood here is going to push this septum primum open such that there is the formation of a new foramina called the foramen ovale, such that this now acts as a valve. When blood comes here and it goes, because the pressure here is higher, it's going to push this septum primum open like a flap valve. It's going to push it open, and blood is going to go through this foramen ovale into the left atrium. Okay, and remember, blood cannot go back. If blood attempts to go back, it's going to push this against this, creating a form of functional valve system. Really beautiful. Okay, and that is how the inter-atrial septa is formed. Okay, that is how the inter-atrial septa is formed. So if we really wanted to draw this, okay, so this would be the septum primum here, and the septum secundum will be somewhere here. Now remember, after birth, because there is a reorientation of pressure, the left atrium now carries a higher pressure than the right atrium. Okay, blood is going to attempt to move from here, but because this place overlaps this place, it's just going to help to occlude this aspect, and after occluding for a long time, there's going to be fusion here. Okay, and once the place fuses, you have your atrial septum. I hope that is clear. You can read more about that, but that's basically how it is formed. As a recap, septum primum it joins with the endocardial cushion. You have formation of the ostia secundum. The ostium secundum goes, you have the septum secundum coming down, joining with the septum spurium at the left valve to form this thick fibrous layer, and then allows this remaining part of the septum primum to act as a flap valve due to the pressure difference. Okay.